early on this Saturday, patchy fog. Otherwise, some sunshine, humid this afternoon, the high 78. Good
morning, everybody. It is intellectual medicine time. Yeah, I know I got background noise from the station as slow as it goes. Yeah. So today we're going to be talking about the conundrum, the dilemma, and the uncertainties when you're told that you have a lump, a nodule. Say it's in your prostate or your breast. Suppose they want to stick a needle in it. If that's cancer, are you going to metastasize it by putting a needle in it? We're going to reflect upon that and discuss some options. Talk a little bit about the Alzheimer's and germ theory and the new Apple Watch. Is it good to track your heart rate? Right?
No.
Actually, I'll keep that here in case I need to research something. Keep it within a mom's reach.
WPRO presents Intellectual Medicine with Dr. Petteruti. Join Dr. Petteruti as he guides people towards living the 120 lifespan while retaining youth. Applied logic, reason, and scientific evidence to address conditions that drain people of their joy and vitality while protecting people from the harmful aspects of conventional medicine. Now, here's Dr. Steve Petteruti.
Good morning, everybody. It's Dr. Petteruti. You're listening to Intellectual Medicine. I'm here with Shannon on WPRO, the intellectual voice of Southern New England. You ever wonder, Shannon, about needle biopsies? When they stick a needle in something, there's a concern some people have expressed and some doctors have expressed that maybe you're spreading cancer and kind of piercing the veil a little bit, and these cancer cells can escape. Has that thought ever crossed your mind?
I don't think it makes sense, right? You're making a track. You go in, they can come out.
Now, this is a problem, people, because it cannot be studied. And this broadens our conversation, right, to a bigger topic. What is evidence? What thoughts are worthy of debate and discussion? And what options can we bring to the table? So we're going to talk a little bit about that this morning. And I'm going to present you with two real-life cases of patients that we've encountered recently in order for you to reflect upon your thoughts. What would you do if you were in this position? And really, what should we be offering and how should we be looking into the options we've got to help people, to help diminish the possibility of spread of cancer? We need to talk about that. Some information and ongoing debate and discussion about an infectious theory of Alzheimer's. Is it possible that a virus or bacteria cause Alzheimer's? We're going to share our thoughts on that with you today as well. And the new Apple Watch is out, and guess what? You can track your pulse. In fact, you can even get an EKG. Isn't that wonderful, Shannon? Get an EKG.
Oh, God, can you imagine all the people?
It's like, first of all, an EKG is
showing up in the ER. Look at my Apple Watch.
That's a great point, Shannon. If somebody shows up in an ER because their Apple Watch alerted them to an irregular heartbeat, should Apple pay for the visit? I mean, really, people, how antiquated, first of all, is an EKG? So much misdirected comfort. I have a normal EKG. Big deal. Means next to nothing, right? I remember we were doing those routinely. They used to do an EKG every time, part of the annual physical. I'm okay. My EKG looks okay. Until they found out it meant nothing. They stopped reimbursing it. And you know what happened when the insurance companies stopped paying for it, Shan? Doctors quit doing them. Yep, we stopped doing them. So here's the genesis of a lot of our medical system. I had a patient come in this week, Shan. He said something kind of funny. He goes, Orthodox medicine, they can do two things. They can cut stuff out and they give you a pill. So that's about it. So looking back at that, what do you want to tackle first? You want to talk this Apple Watch, or should we talk about needle biopsies? Needle biopsies. We got to talk about that. So here's the dilemma. The dilemma is you've got to get tissue to make a diagnosis. There's not an imaging study available that conclusively determine whether or not something is cancer. There are imaging indications that can tilt in favor or against. Ultimately, tissue's what we need. Now, how do you get it? You could operate, right? You could look at a lump in a breast and say, you know what? I don't want a needle biopsy. I just want you to surgically excise it with clean margins to diminish my risk of metastasizing. Of course, it's a huge problem. You're going to be taking out a lot of benign lumps. and subjecting women to surgical consequence unnecessarily. Conversely, if you stick a needle in that lump and it turns out to be cancer, how do you know you haven't stirred the pot and are shedding cancer cells? You really don't. Now, here's the most honest answer that can be given to this question. This information will never be known. All we can do is theorize about the possibilities. Now, I'm convinced that if there is not a solution to a problem, the problem gets ignored. So, for instance, what remedy, what means of intervening with this possibility does medicine have? You can't do chemotherapy on a suspicion that you might shed cells. It's too toxic. So they got nothing, right? They got nothing. Well, we have an option that we're going to discuss that offers possibilities, and it has to be spoken carefully and with an asterisk that it is not proven. We're operating in a realm of theory. And the realm of theory is apropos when evidence will never exist to conclusively determine a path. What do I mean? We will never know if sticking needles in cancerous nodules will increase your risk of metastatic disease. It's impossible to study. Therefore, we've got to take the logical extension, and herein lies the essence of intellectual medicine. They did a study and they declared that needle biopsies do not spread cancer. You know why, Shannon? You know how the study was done?
I'd love to know.
Okay, they took patients with pancreatic cancer. Let me pause right there.
Yeah.
What's wrong with this study already? Patients with pancreatic cancer. At the time of diagnosis, they're all metastatic, all of them. It is almost universally fatal, almost. There have been some wonderful advances that improved care, but it's a horrible disease with an aggressive path. So one group, they did a needle biopsy first. The other group went directly to surgery, and they found they had equal metastatic and death rates. Well, it's a horrible base to make that study. Now, let's look at another scenario, something that is more apropos, which is breast cancer or a nodule. You have a nodule in your breast, and now you have to decide whether or not putting a needle in it is going to increase the risk. Dr. Shemala from India did a literature review study and published his thoughts and findings, and he felt that the risk of seeding from breast cancer is amongst the highest of all cancers. That's sad because we've got no great means of remedying it. Now, possibly, I should say, if the needle track were to metastasize the cancer, and you follow that up with a good, clean surgical excision, maybe you captured those, unless those cells disseminated throughout the circulation. Now, what we know about cancer cells, they have poor adhesive qualities. They don't stick together very well, so they're easy to stir up. I had a patient who came to me recently, and she's been observing a mass in her breast, and she's been delaying intervening. Part of her fear factor, Shannon, was, I'm afraid if they put needles in it, that cancer cells are going to spread. Of course, now you've got a real standoff. You have to get tissue. You can't allow that to fester. So what she opted to do, and what we supported, was doing a high-dose intravenous vitamin C infusion before and after the needle biopsy. Now, folks, this is not FDA approved to cure cancer. I have to put in that qualifier. But the logic is there. There's a possibility, based upon the scientific results of vitamin C being shown to be toxic to cancer cells, that if you're having a few of these cells escape into your system and you whack it with a high dose of vitamin C, that the vitamin C can kill those stray cancer cells. That's a possibility. And for this individual, that possibility, the safety of the treatment, and its modest low cost, all factored into her decision to have the infusion done before and after the biopsy. You know what, Shannon? It gave her greater peace of mind going into the procedure. Mm-hmm. I see no downside to that. That's what I would choose to do. You stick a needle in a lump. I want my C before and after, intravenously, at high dose, for the possibility of killing stray cancer cells. So, when we come back after the break, we need to continue this conversation because we're not doing enough. We're not doing enough to support the health and vitality of people with cancer, and we're not doing enough to prevent it from happening, and we're doing too much to pollute our planet and increase carcinogenic toxins there's not enough motivation to search for alternatives, and that's what we're here for in intellectual medicine. So we'll be back right after this break talking more, and when we come back, we're also going to be talking about the Alzheimer's germ theory as well. I'm Dr. Petteruti. This is Intellectual Medicine on WPRO.
News Talk 630 and 99.
Yeah, so this drives me crazy. Oh, center the band? Okay, thanks. This drives me nuts. By merely talking about this possibility, we expose ourselves to risk of censure. The intellectual medicine approach is built on thoughtful and provocative questions being asked to medical dilemmas and exploring means of intervening that aren't just established pathways of medical care. As good as they can be in many cases, they're just not comprehensive enough. And there becomes a petrification of thought based upon a desire to be conformist. So like this, if the only thing you ever do is that which has always been done, by definition, you'll never do anything new. And new things, innovative things, are where the progress happens. It's where improvement occurs in every endeavor. That improvement is not linear, and some innovations turn out not to be worthwhile. Let me rephrase it. Some innovations prove their worth by validating they have no merit, thereby enabling us to move on to the next thing. So in intellectual medicine, we're looking at some of the core elements. We're going to talk in a moment about atrial fibrillation and about the new Apple Watch and about finding data that may not be important, or finding data and then looking at a way to mitigate a symptom rather than get to its core. And I think, Shannon, that goes to atrial fibrillation. Something like 6 million Americans will be diagnosed with atrial fibrillation. It's a fast-growing entity. It is a very profitable diagnosis. You've got interventions like cardiac catheterizations, ablation of electrical circuitry, very expensive, highly remunerated, very hospital-centric. You've got drugs to thin your blood. You've got drugs to lower your heart rate. It's incredible when you consider, well, what actually makes it happen? What's underneath the AFib? Now, how about magnesium? We know that low magnesium is fairly widespread, and magnesium is critical to stabilize heart rhythm. How about coenzyme Q10? Look at all the people on statin drugs. How many of those people are not getting repleted with CoQ10? It's an essential ingredient that feeds the mitochondria, that stabilizes the cell, that can be a cofactor in healthy hearts. I had a doctor friend of mine, Shannon. He was in his late 80s at the time, and he was diagnosed with AFib, and he didn't want to do any of the orthodox treatments. He put himself on 800 milligrams a day of CoQ10. He said within a month it was gone. Now that's just one case study. Excuse me.
This isn't 1970. Keep your hair and your
We'll just summarize his information. What's his question or his statement?
Check them out today because they're giving away.
Oh, what's his question or his statement?
So something continuing the conversation with cancer prevention with something called the Kirkman method.
Yeah, see, I'm a little bit wary of those being self-promotions. So let's just have him transcribe his question, and we'll either get to it this week or next, but I don't want to put him on air.
Is protected by the Boston guarantee.
Ever heard of a Kirkman method?
So right when
Yeah.
you're back, I'll have it, and I'm going to type it in the studio chat thing on your computer.
For 200.
Okay, we'll take a look at that.
To 85850.
So with regard to cancer prevention, there is a cottage industry on the internet of a whole array of interventions and advice.
To intellectual medicine.
My advice is talk to a doctor about advice, or an intellectual medicine doctor.
21 WPRO.
Hey gang, we're back. It's Dr. Steve Petteruti. This is WPRO Intellectual Medicine. I'm here with Shannon and with Tyler. Hey Tyler, how you feeling today, buddy? Well, would you like to have a watch that could tell you what your heart rate is? She did? Shannon, why did you talk him out of? He needs to monitor his health. You reckless, You reckless wench.
Right?
What are you doing?
24 hours a day, right? Everyone should know.
We should know.
Exactly. You should know your numbers.
I want to know my numbers. How can that be bad?
Never, ever have I thought, I wonder what my pulse is right now. Never. It's never occurred to
Right,
me.
because you're a young, healthy woman,
Yeah.
right? So I'm in, well, let's just say a tad older.
I'm
and
just saying, if your pulse is where you're thinking, I wonder what my pulse is, maybe.
So
issue.
let's come back to this. But I do want to talk about the lump dilemma. So we talked about a woman with a breast cancer lump, or a lump that was highly probable to be cancer based upon its clinical pathway, the physical examination, and the mammogram, and what to do to help minimize the possibility of metastatic spread from a needle biopsy. Now, bear in mind, folks, I am not counseling you to avoid needle biopsies. I'm raising a dilemma in medicine, and I'm expressing the reality that we'll never know the answer. We do know some of the ingredients that go into contributing to a cancer-friendly environment, right? High sugar, high adiposity, low vitamin C correlates with cancer. So how about what we can do around the time of that needle biopsy? I like the idea of the high-dose vitamin C. It's inexpensive, it is safe, there's a possibility that it can have benefit. Not only with regard to the possibility of killing cancer cells, but vitamin C is an important constituent of collagen formation. And any time there's been an operative intervention, your body, and even a needle biopsy is a disruption, your body needs the collagen to rebuild and repair. So here's a case you guys can reflect on. This gentleman was in his 60s. He had a borderline PSA. He had a desire to go on testosterone therapy for supporting strength, energy, mental clarity, vitality, libido function, bone density. He was suffering with some of the invariable effects of aging, right? This is normal aging as it's described in the orthodoxy. You're getting tired, your energy fades in the afternoon, you're gaining a little fat in the midsection, your interest in sexual activity is fading, your brain is slowing just a little bit. And you're wondering what can be done, and you've heard about testosterone therapy, and you've talked to others that are raving about the effect it can have, life-changing benefit to many, many, many patients. The growing evidence tilting against long-term adverse consequence. So you want a piece of this. Well, here's a problem. Studies have demonstrated that a large chunk of men, as we age, we're going to develop prostate cancer. Here's what we don't know. Will that matter to our long-term health? Prostate cancer oftentimes remains indolent, remains buried in the gland itself. In some cases, it can extend beyond the gland, and it is a cause of cancer death. So what to do? Well, this gentleman had the borderline PSA. We tracked it. The PSA remained fairly stable, and we went on and did an MRI. They can now do MRI of the prostate, and took a close look at the gland and found some nodules that were not at all appearing to be cancerous, and one nodule that was equivocal. That means maybe, maybe not. It didn't have attributes that pointed toward cancer. So imagine you sitting on this information, wanting to be on testosterone therapy because it makes you feel great, and it gives you all those other health benefits we spoke of, but you just don't know. There's this nodule inside. So you can do a biopsy, right, Shan? You could do a needle biopsy. You could take a sleeping giant and awaken it. There's a possibility that if that cancer is indolent and you go stirring it up with a needle biopsy, you'll make things worse. And prostate biopsies are uncomfortable. They can lead you to feel poorly afterwards. I've talked to patients that have felt not well for weeks. So certainly that's an option, and it's a reasonable one because it gives you a piece of information, but only a piece. Another problem with prostate cancer, if you have it, it's not necessarily going to be captured by that needle. A 1 centimeter nodule with a tiny needle being poked into it may or may not reveal the cancer that's present, since the cancer can be speckled throughout that area and not consistent within it. So for this patient, he's made a decision to forego a biopsy, to go on testosterone therapy, to monitor his health through a prostate-specific antigen blood test, and he's also made a decision to do periodic chelation and high-dose vitamin C infusion. Now, why? How do those connect? Chelation intravenously pulls out heavy metals. Those include metals like cadmium, which is a carcinogenic. Now, the risk of cancer with regard to exposure has to do with the volume of exposure and how near you are to it. Radiation is a carcinogenic. If you're closer to it and have a higher dose, your risk goes up. If the carcinogen is inside your body, that would logically conclude that that's a significant risk factor. So the cadmium gets to be removed, not fully, but diminished through regular intravenous chelation. What about intravenous vitamin C? In the face of somebody with an unknown entity, will it affect the possibility of cancer manifesting? Short answer is we don't know. The studies are not done. I don't think they'll ever be done, Shannon. I don't think you can study this. Let's talk about your case for a moment, and then we'll circle back to our other patient. So Shannon has had melanoma on 2 separate occasions, surgically removed, no evidence of extensive metastases. Now what, right? Suppose there are some stem cells of cancer floating around in her body. And imagine those stem cells are creating new cancer cells. There's something called a doubling time. It takes a while for those cancer cells to expand. Let's say about 2 months on average for one cell to become 2, 2 to become 4, etc. You can go years and years and years feeling great while the cancer is growing, unbeknownst to you. And by the time it appears as a 1 centimeter nodule, it's doubled 30 times. And sadly, the next symptom of melanoma for those that have had it removed in its infancy is broad metastatic disease that is incurable. Brain, other organs, that becomes your next symptom. So what can we do between these 2 spots on the curve? The possibility of a regular IV high-dose vitamin C being administered maybe every month, every 2 months. We try to minimize the exposure. On the other hand, we just don't know the ideal interval. It's based upon the theory of the doubling, how quickly the cancer may double, and the theory that cancer is more vulnerable when it is in its infancy. That is, if it's floating around as a few cells rather than a formed tumor mass, the vitamin C possibly could be killing some of those cancer cells and preventing them from developing to the point of creating a tumor. So that is something that we are proposing is worth considering. We're not saying it will cure cancer. We don't know if this approach will lead to a diminished rate of cancer relapse or formation, but it sure as heck sounds logical to me when we know there's scientific evidence of vitamin C killing cancer cells. In my opinion, vitamin C is too often used as a last-ditch effort, if you will, a Hail Mary pass in the face of somebody with extensive stage 4 cancer. It has something to offer in that setting with mitigation of symptom, but if you're on the doorstep of mortality, if death is the next event to occur in your life, a miraculous intervention is rarely the outcome of high-dose vitamin C. Turning back to our guy with his nodule, well, why not do a vitamin C every month or 2? If he's making little baby cancer cells on that prostate, he can do that the rest of his life with the vitamin C. No harm will ever come of it. It's not burdensome with time or money. It's generally beneficial with collagen formation. So a lot of positives, not many negatives. The possibility is intriguing. We are gathering this data at Intellectual Medicine, both Dr. Souza in East Providence and at our center in Warwick, and soon other centers will be doing the same. We are tracking these patients, those that have had cancer in the past and have opted for the intermittent vitamin C approach, and those that are on a primary preventative pathway as well. We welcome these patients. We welcome you to be considered and to contemplate how this may fit. Certainly, people with cancer, it's a worthy consideration. It is one of the most powerful elements in the complementary care regimen. Now, we are going to take a break. When we come back, I want to talk about the broad field of cancer preventative stuff that's on the internet. But next up, Doug Lizette from the Revolution Softwash News Center. Doug, what's happening out there?
Doctor, a tropical storm Lauren
I have a question from Joe.
Hey, Joe.
He wants to know. Oh no. It's very important. Hold on.
What does Joe want to know,
He
Shannon?
wanted. It's like gone. It's not there anymore. It was about Chris Sale. And is he going to be in the playoffs?
Oh, it's Chris Sale.
Yeah.
Oh, absolutely. Chris Sale is just, they're treating this like spring training for him, and they're ramping him up for the playoffs. And I think that he's going to be in dominant form by the time the playoffs roll around. Look, there's absolutely no need to put Sale out in any game situation other than to train his arm back up. And I think that they learned last year that the guy burned out into the playoffs. This year, I expect him to be totally dominant. And if he isn't, I would trade him because he doesn't. All right, he's great when he's great, but you got to have stamina. So, yes, Sal for the playoffs. Yeah, the Red Sox are in the World Series. I don't see them stopping. People are worried about their bullpen. They're going to shuffle around their roster, and they'll move some guys into the bullpen who aren't there now from their starting rotation. Playoffs are a whole different animal. So we're going to be well rested. We're going to be healthy, and we're going to move into the World Series. We'll beat Cleveland to get there. But I want to also mention the Patriots. I have to confess, I picked Houston last week. Feel bad about that. But our Patriots are how to put this, one of the best versions of the Patriots that we've seen to come down the pipe in quite a while. I think one of the great talents of Bill Belichick is as a general manager or GM. He picks talent. He picks guys that nobody else recognizes, a bunch of no-names. The rookie now playing linebacker for us, led the team in tackles. The receiving core, highly underrated. You know, these guys are performing. And, of course, we got Julian Edelman coming back in 3 weeks. That doesn't stink. So we're going to go down to Jacksonville. We're going to beat them.
Joe said shame.
I know. How could I have picked Houston? Nothing about Houston I like. Actually, their quarterback's pretty cool. Deshaun, he's pretty cool.
Patriots won, though, didn't
They did win, Shannon. They did. Yep. You know, the thing about... Here's the psychology about picking against your favorite team. If they win, you're happy, and if they lose, you have, like, bragging rights. That's real shallow, isn't it? So we got to talk about this Apple Watch. The danger of hyper-diligent... Any questions, guys, about this whole nodule thing? Any questions about the vitamin C? See, I really think that we need to do more, being proactive, making a strong plan. Look, I had a gentleman who came in to see me. He has stage 4 cancer. He's in hospice, but he's walking, he's talking, his brain's intact. His big concern is, I've got no energy, I've got no power, my quality of life is horrible. So we did some testing on him. You know what we found out? His thyroid's not working. He has no testosterone. Well, just because you have terminal cancer doesn't mean that you've abandoned the joy of living. Nor does it mean that you should abandon the possibilities of these type of supportive treatments helping you. So yeah, we put him on thyroid medicine. Yes, we put him on testosterone therapy. Yes, we're endeavoring to make his quality of life better instead of just sitting there looking at the clock, looking forward to his death. And he has chosen to go on an aggressive regimen of intravenous vitamin C, along with intravenous mistletoe therapy, hoping that his symptoms will be improved, with the possibility of slowing the rate of progression of his cancer. Now listen, it'll be a miracle if he doesn't die within 6 months of cancer. But the possibility of improving his quality of life, the possibility of slowing the cancer's progression, the safety of this regimen, and for he and his family, the knowledge of knowing that they have put forth the highest intensity of interventions that they can think of, are all going to give them some comfort. You know, I applaud that spirit. I would hate, Shannon, I'd hate to be the guy sitting there watching the sand fall through the glass with no alternative other than waiting to die. That, to me, would be against my character. You mean to tell me there's something that maybe will help me feel a bit better, that'll do me no harm, and that has a possibility of delaying progression of my disease? Sign me up. Where's the downside here? Well, I'll tell you what the downside is. It's time and it's money. Precious commodities when you're balancing both. So in any complementary care realm, They have to be factored in. You do not want to leave your family with a burden, with a double trauma of your death and severe indebtedness, right? So if you can afford this approach, and it does cost hundreds of dollars, in some cases it can go into the thousands, but it's not tens of thousands, and compared to conventional therapy, it's cheap. Unfortunately, insurance doesn't pay for it. See, I think that anybody diagnosed with a serious form of cancer should have $50,000 put into a health savings account by their insurance company to apply it toward care that they deem appropriate and supportive of their need. Yoga therapy, massage therapy, Reiki therapy, these complementary care modalities ought not to be available just to the well-to-do.
Have the conversation with Tom now before the days get short.
I've got the full message typed out for you in the.
Thank you. Yeah, we won't get to it this week, but we may circle back to it next.
Yeah, all good. But just so you know, it's there if you want it.
Can it be like printed so I could carry it?
Take a picture.
Not from here, but I can take a picture and text it to you.
Well, I can get a picture. Shannon just told me to on my phone, so I'll do that. Yeah. I really can't see it. Let's see. There we go.
We'll do it later.
I just want to move the mug of myself. Oh, curcumin method.
We'll do it later.
Okay. All right. Apple, Jewel, platelets.
What are we talking about for your interruption?
We'll talk about the Apple Watch since I've been mentioning it, and then we'll, if time allows, we'll get to we should be able to get to the Alzheimer's germ thing.
Now back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-321-WPRO.
Hey gang, we're back. It's Dr. Petteruti along with Shannon at Intellectual Medicine. Now Shannon, you were a track star in high school, as I recall. Didn't you do some track events?
Mm-hmm.
Did you ever do a 200-meter race?
No, I couldn't do it.
You couldn't do it. Why is that?
Oh, not enough stamina.
You never understand with 200 meters.
Always 100 only.
Have we had your heart evaluated? Did I know this before we became involved? I know you're a sprinter though, right? 100 meter, you were fast. Well, you know what? Congratulations to Man Cower. She recently set the record for the 200-meter dash in the over 100 age group. That's right, people. The 100 to 104 age group. She set the record, 3 minutes and 14 seconds. Stop laughing. It's a sprint at that age. Hey, that's exciting to me. You know, we're looking at the possibilities of anything. See, this is the key to being a champion, Tyler. You got to live long enough so that all your competitors are dead. That's like it's been said in medicine. The way you convince your critics that you're right and they're wrong, wait for them to die, because they're not changing their mind. Evidence will not bend a rigid brain, and there are a lot of rigid brains out there, folks. Fortunately, you don't possess one because you're listening to us, and by definition, that makes you part of the Intellectual Medicine Club, and it makes you a thinking human being. And thinking human beings are going to question the wisdom of a heart that wristwatch that monitors your heart. What's next? An EKG that tells time? Like, really? So here's a problem. And by the way, the American Heart Association came out and said that this is a, quote, game changer, end quote, as if to endorse it. Well, guess what? Guess who gets to have special status as an app on the iPhone? The American Heart Association. American Heart Association is a over $1.5 billion monopolistic entity. Look, they do some good things, but boy, I don't trust their advice. I think it's often tainted by corporate donation. And although I have no evidence about this, I wonder if Apple has donated money to the American Heart Association. I mean, I just would like to know that. How is this a game changer when for 1 billion years you could take your hand and check your pulse, right? We could all do that. Furthermore, they said this is good because they can pick up asymptomatic irregular heartbeats. That means irregular skips in your heartbeat. People, it's normal for your heart to skip a beat. It's normal. It's abnormal for the heart to be consistently regular. That's a sign of autonomic dysregulation. It happens in advanced diabetics. It's unhealthy. So now we take a normal phenomenon, a skipped heartbeat, we create an ability to monitor it so that we send people dashing into the healthcare system. Good Lord. Protect yourself. Don't go there. Well, suppose this wristwatch determines you have atrial fibrillation. Intermittent AFib, what does that mean? Every now and then, your heart goes into a burst of irregular beats. And you may feel that. It can be a flutter in the chest. Now, in some cases, atrial fibrillation can increase your risk of stroke. However, if you're otherwise healthy, you have no known heart disease, you're not a diabetic, and your heart goes into an occasional AFib, there's no strong evidence that's going to increase your risk of anything. Your doctor can help analyze this, but here's the problem. They said, this is great. 6.4 million people or greater have AFib, intermittent AFib. Now they're all going to the cardiologist. This is great for business, right? Catheterizations, ablation therapy. They go in there and they electrocute the circuitry of your heart in the hope of stopping the atrial fibrillation. You have to get echocardiograms. You've got to go on drugs. This is orthodox medicine at its finest. Taking healthy asymptomatic people with a risk factor like AFib, and rather than pausing and saying, gee, why do you have AFib? Maybe we can fix that. Well, how about analyzing lifestyle, nutrition, magnesium, coenzyme Q10, mineral content? What do we know about the heart? The heart doesn't like being irritated. What irritates the heart? Alcohol, excessive exercise can be an irritant. Adiposity, obesity can be a heart irritant by increasing free radicals. Radiation therapy, X-rays, create hydroxyl free radicals, which are horribly aggressive to the body. Therefore, what we like to advocate, I was telling you, Shannon, about the doctor friend of mine in his late 80s, diagnosed with AFib. They wanted to put him on drugs. He said, no thanks. He put himself on 800 milligrams a day of coenzyme Q10. His AFib went away. Now, placebo, coincidence, who knows? All I know is it went away, and coenzyme Q10 never hurt anybody. How about magnesium? High-dose magnesium. Magnesium is critical to soothe spastic muscles, including your heart. Magnesium supplementation has a possibility of diminishing irregular heartbeats. In some cases, it's best to do it intravenously at Intellectual Medicine at the Drip Bar over in Warwick, and Dr. Souza's Drip Bar over in East Bay and East Providence, right near Barrington. High-dose IV magnesium, extraordinarily safe, can be very soothing. So there are things that can be looked at before you dash to the doctor and before you start doing medical procedures that can be harmful. Is the Apple Watch intrinsically harmful to health? It could be. The possibility of, let's face it, can you imagine somebody a little bit on the neurotic side, the hypochondriacal side, getting this piece of equipment and then having to interpret it all the time? Imagine the stress that's going to impose on folks. I have people in my practice that have home blood pressure cuffs. They're doing their blood pressure 4 times a day. I had one patient call me up every day. Doctor, my blood pressure is fill in the blank. That's good to note. Point is that information improperly diminished or distributed can be harmful. So part of our job in intellectual medicine, folks, protect you from the consequences of orthodox medicine. And when we come back, we're going to talk a little bit about the brain, about how to keep it fresh, and what things may play into cognitive decay. I'm Dr. Petteruti. This is Intellectual Medicine on WPRO. We'll be right back.
Okay, question.
Yeah.
Would you recommend any other treatments along with the high-dose vitamin C for someone who has gone through chemo and radiation for stage 2 breast cancer 3 years ago? I feel great because of proper nutrition, but interested in doing more to prevent anything in the future. I've not gone back to the doctor for almost 2 years because they keep pushing mammograms, ultrasounds, and meds, and they're not interested in talking about vitamins.
Yeah, what a brilliant question, and congratulations on your recovery, and good luck on your future health. Yes, there are other things I'd recommend. For your circumstance, no tumor, no evidence of active malignancy, but a high risk of relapse. New England Journal of Medicine did an article looking at what they call remote metastases from breast cancer, which means 10 years after the cancer. Those 5-year relapse rates are not good enough. When you have a stage 2 cancer, you've got a 10-year relapse rate that exceeds 10%, may go as high as 20. That's ominous. So you don't want to sit idly by. So here are the other things. I recommend monthly high-dose IV vitamin C infusions. We titrate up to 50,000 milligrams once a month. It's cheap, it's safe, there's no downside, and if your body's trying to make new cancer cells, there's a possibility where you could be killing them before they organize into a tumor. The other thing, immunologic support. I like a high-quality beta-glucan. Now, beta-glucans are ubiquitous. They're all over the internet. But you want one that's the right molecular size so it can get in the white cells and be of some help. I like my patients to go on metformin if they can tolerate it. Metformin has been shown, it's a prescription drug used for diabetics, helps lower your blood sugar level. It's been shown to have some anti-cancer properties. If you can tolerate it, low-dose naltrexone, and you can look that up on the internet. If you Google LDN and cancer, it'll come up. Another affordable, inexpensive prescription that can be helpful in that we believe has a possibility of preventing cancer relapse. What about your diet? Yeah, the diet's super critical. You want to avoid carcinogenic processed foods. You want to keep your percent body fat less than 35. At Intellectual Medicine, we routinely would do a body analysis to determine percent body fat. Now, here's a big issue for young women with breast cancer. Do you deprive yourself of hormones for the span of your life? Tough question. In many cases, women have chosen to use hormone therapy even though they've had a prior history of cancer. More specifically, they'll use a low-dose testosterone therapy, which is provocative because some studies indicating it may actually be preventative toward cancer relapse. This is still a brave frontier and not fully delineated. But percent body fat reduction, I would probably advocate for chelation. A hidden cause of breast cancer is cadmium. So I would do a heavy metal test. The heavy metal test is about $160. Well, for $160, we can know how much cadmium is buried in your bones in your body. You get that done. We see a lot of cadmium. We'll rotate sometimes vitamin C with chelation because they both have merit. There's a lot that could be done to make your future different. My advice to all women who've ever had breast cancer, and really all cancer patients in general, it's not good enough to survive your chemoradiation and then go back to life as usual. We've got to do more. They're calling me. Okay. Shannon, you want to amplify that point on our show, on the radio now?
About that?
Yeah. That question for the broader audience.
I would say just, I don't know.
Okay. All right. Wait. Shannon, my heart just skipped a beat. What am I going to do? It skipped a beat. Damn it. That means I'm going to die. Well, someday. I don't know. Maybe. So my goal, folks, is to seek for my personal well-being, my interest. I want 120-year lifespan. That's what I'm aiming at. Tyler, you got to be bucking aiming at 150, buddy. I'm sorry. You don't get out that easily. If you're listening to my voice and you're below the age of 40, you got to be prepared for the possibility of living to be 150. It's scary to think about. Well, here it's a weird dynamic. It's going to blow up the. If you're worried about what color the hair will turn, you're already in good company. It means you've got hair. That's step one. So we need to talk about Alzheimer's. We promised that we would. Look, there are a few things more terrifying than the notion of acquiring Alzheimer's disease. Well, let's start out with the realization that Alzheimer's is not a disease. It's a constellation of insults to the brain that lead to a symptomatic state of deteriorating memory. These amyloid plaques that have been ascribed to Alzheimer's disease may not be the cause of the disease at all. Every intervention looking at delaying, diminishing, or altering the amount of amyloid plaque on the brain has been disappointing. It turns out, did you know these amyloid plaques actually are part of an immunologic response to infection, and it may be that case. Amyloid has been found to be toxic toward bacteria and viruses in the lab. So it's possible, and some scientists are now starting to contemplate, is a virus or are bacteria contributing to dementia? And is the amyloid plaque that we see on the brain not the cause of the dementia, but part of the body's response to dementing infections that are afflicting the brain? Compelling thought, especially in the absence of a genetic risk that is directly correlated. Listen, if your folks have had dementia or not is nearly irrelevant to your risk of acquiring it. This, ladies and gentlemen, as best we can discern it, is an environmental disease. It's an interesting detail that the spouses of demented patients have a high risk of acquiring dementia. Why? Well, they share the same environment that could support an infectious theory, or could support an environmental theory regarding nutrition, toxic metal exposures, and other risks. Well, what about the neurosurgeon's increased rate of dying from dementia? They don't share the same environment as their patients, but they're cutting open brains all the time. Maybe those virions are affecting them. We don't know. But it deserves contemplative thought. So they have found in some studies an increase in herpetic viruses in the brains of Alzheimer's patients. Here's a problem, and it goes to cause and effect. The thing that kills Alzheimer's patients invariably is infection. Their immune system fades, they weaken, and they die of pneumonia, they die of sepsis. That's their final event. It turns out the brain is a critical component of the immune system. If your brain weakens, your immune system weakens. So what's underneath the presence of the virus could be a fading immunologic support in general and specifically in the brain. Well, what things support the brain's immunologic function? We're finding more and more about the brain's immunologic importance and the fact that the brain itself has immunoglobulins in it. The brain itself has factors in it that are a component of the immune system. And there is now growing evidence that your hormones play a critical role in that. Testosterone and estrogen may well affect the immunologic integrity of your brain. Studies have correlated the decrease or absence of testosterone and estrogen with increasing dementia rate. Observational study in men who had their testicles removed due to prostate cancer showed increasing rate of dementia. Women who've had total hysterectomies, get their ovaries out at a young age, and do not get their hormones replaced, increasing risk of dementia. What's going on? Well, it turns out that our brains really run on testosterone to a great extent, that estrogen is critical to the immune function of the brain, and that without adequate support, the brain slows down. Shannon, how many times you see patients in our practice, and how Dr. Souza has seen them, brain's getting a little slow. A chief complaint, I'm a little tired. Yeah, my brain's not so sharp. It's a little slow. You know, my doctor says it's okay, though. It's normal for my age. No, stop, no, back away. Walk slowly out the door. It's not normal for the brain to decay. You ought not to accept that at any point in your life. If the brain is weakening, you need to dig into the facts. What's your lead level like? What are your hormones like? What's your percent body fat? Can we do things? Do you have micronutrient support? Had a patient in a few weeks ago, fog, brain, fatigue, muscle aches every place. In 2 weeks, she feels great. What happened? We infused her with high-dose vitamins. Everything got better. In her case, she had broad micronutrient deficiencies. Your brain is an organ like any other, deprived of its essential nutrients. It ain't going to function right, people. What about oxidative stress? Free radicals corrode the brain. In one study looking at alpha lipoic acid, very small study, it was a cohort of maybe a dozen patients. They put one group on alpha lipoic acid at 600 milligrams per day, the other group nothing. The alpha lipoic acid group had a plateauing of cognitive loss. These are people with already diagnosed Alzheimer's disease. Why would that be? Well, alpha lipoic acid is a fat-soluble and water-soluble antioxidant. Your body makes it naturally. As we age, we make less of it. It's a critical antioxidant. It neutralizes free radicals. those hydroxyl free radicals that occur are really aggressive. They corrode your brain. So what we can do to neutralize free radicals, the excess abundance of them, may well be protective of our brain. I take 600 milligrams twice a day. Shannon, you would, but you can't swallow things. Sorry, it's just the way God made you. We got to be very, very, very careful about that. But with regard to alpha lipoic acid, quality matters. There is a pharmaceutical grade form of alpha lipoic acid. In Germany and in Korea, it's a prescription drug. In America, it's an over-the-counter supplement. You've got to be careful of the source. And while I'm on that topic, folks, I encourage you to go to the internet. I encourage you to go to PubMed. I encourage you to Google cancer prevention, vitamin C, low-dose naltrexone. But I caution you to dive into internet-based treatment protocols in the absence of some type of partnership with a knowing clinical source. And here's why. There are too many simplistic approaches on the internet that will tout a nutritional or supplement intervention as being the end all and be all. There may be kernels of truth out there, but ultimately you've got to put it all together. I've seen patients come to me who've been, in fairness to them, it's really hard to find a doctor that's willing to have this conversation. Dr. Seuss is brilliant at doing it. We do it all the time at Intellectual Medicine. There are educated, knowledgeable chiropractors and naturopaths that have a broad interest in this. Unfortunately, there are very few orthodox physicians that have interest, the time, or the inclination. And I would say that even if they have a deep interest, the constraints of their time and their overlords of the insurance company and the entities they work for would censure them if they sat and talked to you about intravenous vitamin C. Folks, that's why we exist. The best I could hope from your oncologist or your orthodox doctor is simply to say, I'm not an expert in that field. I recommend that you talk to somebody who is. That's what we hope from our colleagues. Listen, if you want to know what chemotherapy to use to treat your breast cancer, don't ask me. It's not my specialty. It's the oncologist's specialty. We have to trust their judgment in that realm. It's not an either-or dynamic. It's not that orthodox oncology is bad and vitamin C is good and that you should avoid one and embrace the other. No. You want to bring it together. So be wary of an internet-driven pathway of care. I will say that. Internet-driven knowledge is wonderful. Every week our patients bring articles to us, send emails to me. What do you think about this topic or that topic? It's great because I like to say I've got 1,000 research assistants. And you, my dear listeners, you make us smarter, better by your challenging questions and by pushing the boundaries with us. Intellectual medicine couldn't exist and we couldn't grow the way we have without the results we're delivering every day to our patients and without patients willing to open their minds up to the possibility of what could be. Do not idly sit there and let the sands of time fall through the glass. Let's fight back together. Be wary of your Apple Watch. Use it to Google the internet, but not to check your heart rate. Be wary of the specter of Alzheimer's. Take care of your teeth. Dental health correlates with dementia. Take care of your body weight. Obesity correlates. Get the lead out. Have you had your lead test yet, Shannon? Have you done yours yet? You're doing yours this week. I'm tired of you just neglecting your health, right? I'm like the electrician whose lights don't work.
Yeah, well,
Right?
done everything else.
Well, you got to see Dr. Souza. Let him do it for you. Well, folks, it's been another beautiful Saturday morning. We thank you for spending the time with us. Thanks to Tyler behind the glass, does a great job as always. And thanks to Shannon for co-piloting with me. We are Intellectual Medicine. We're here every Saturday morning. We are wishing you 120 youthful years. Well, guys, it was a fun day. I hope you got something that you can use. Feel free to keep those questions coming. We'll be back again next week. In the meantime, get your heavy metal tested. Make sure you're flossing your teeth. If you're not on hormones, why not? If you're below the age of 40, I can understand it. We'll be back again next week with more exciting information. See you then.